A patient with end-stage renal disease is scheduled for hemodialysis. Which lab value should the nurse report immediately before treatment? A. Hemoglobin 10.5 g/dl. B. Potassium 6.1 milliequivalent/L. C. Sodium 138 milliequivalent/L. D. Calcium 9.0 milligrams per deciliter. Answer, B. A potassium level of 6.1 milliequivalent/L indicates hyperkalemia, which can cause lethal cardiac dysrhythmias. Dialysis will help remove excess potassium, but it must be reported and monitored closely. A patient with cirrhosis develops confusion and lethargy. Which lab finding supports the nurse's suspicion of hepatic encephalopathy? A. Elevated albumin. B. Elevated ammonia. C. Decreased bilirubin. D. Decreased prothrombin time. Answer, B. Ammonia accumulates in liver failure because the damaged liver cannot convert it to urea, leading to toxic effects on the brain causing hepatic encephalopathy. Which nursing intervention has the highest priority for a patient receiving a blood transfusion who suddenly complains of chills and back pain? A. Slow the transfusion rate. B. Administer acetaminophen. C. Stop the transfusion immediately. D. Flush the line with normal saline and continue. Answer, C. Chills and back pain indicate an acute hemolytic reaction. The transfusion must be stopped immediately and the blood returned to the lab for testing. A patient with a nasogastric tube connected to low intermittent suction develops metabolic alkalosis. Which action should the nurse anticipate? A. Increase suction level. B. Administer an antacid. C. Discontinue NG suction temporarily. D. Provide 4-bicarbonate. Answer, C. Prolonged gastric suction removes acid, leading to alkalosis. Temporarily stopping suction allows acid balance to restore. Which assessment finding is most concerning for a patient with pancreatitis? A. Abdominal tenderness and nausea. B. Low-grade fever. C. Decreased bowel sounds. D. Gray-Turner's sign on the flanks. Answer, D. Gray-Turner's sign, flank bruising, indicates retroperitoneal bleeding from severe pancreatitis, a life-threatening condition requiring immediate attention. A postoperative patient receiving opioid analgesia develops shallow respirations and pinpoint pupils. What is the nurse's priority action? A. Notify the provider. B. Administer naloxone. C. Reposition the patient. D. Increase 4 fluids. Answer, B. Naloxone is an opioid antagonist that reverses respiratory depression caused by opioid overdose. Immediate administration is life-saving. Which of the following ECG findings is associated with hyperkalemia? A. Prolonged QT interval. B. Peaked T waves. C. ST segment depression. D. U waves. Answer, B. Elevated potassium levels cause tall, peak T waves on ECG and can progress to life-threatening arrhythmias if not corrected promptly. A patient with diabetes is receiving total parenteral nutrition, TPN. Which assessment requires the nurse's immediate attention? A. Blood glucose 210 mg per deciliter. B. Sudden diaphoresis and confusion. C. Dry mucous membranes. D. Mild weight gain. Answer, B. Diaphoresis and confusion suggest hypoglycemia, which can occur if TPN is stopped abruptly. Continuous glucose monitoring is essential. Which patient is at greatest risk for developing a pulmonary embolism? A. Postoperative knee replacement patient on bed rest. B. Patient with pneumonia on antibiotics. C. Asthmatic patient using inhalers. D. Patient with COPD on oxygen. Answer, A. Postoperative immobility and lower limb surgery increase the risk of DVT, which can lead to pulmonary embolism if a clot travels to the lungs. A nurse caring for a patient with SIAD should expect which laboratory result? A. Hypernatremia and low urine-specific gravity. B. Hyponatremia and concentrated urine. C. Hyperkalemia and metabolic alkalosis. D. Hypercalcemia and dilute urine. Answer, B. In SIADH, excess ADH causes water retention leading to dilutional hyponatremia and concentrated urine output. Which action should the nurse take first when caring for a patient with acute pulmonary edema? A. Place the patient in high Fowler's position. B. Start in 4-line for fluids. C. Obtain a chest X-ray. D. Apply compression stockings. Answer, A. High Fowler's position promotes lung expansion and reduces venous return, improving oxygenation in pulmonary edema. A nurse is assessing a patient with a chest tube. Which finding requires immediate action? A. Gentle bubbling in the suction chamber. B. Fluctuation in the water seal chamber. C. Continuous bubbling in the water seal chamber. D. Drainage of 50 milliliters over 2 hours. Answer, C. Continuous bubbling in the water seal chamber indicates an air leak, which can lead to lung collapse if not promptly corrected. A patient with a history of COPD is scheduled for surgery. Which preoperative instruction is most important? A. Withhold fluids 24 hours before surgery. B. Encourage deep breathing and coughing exercises. C. Discontinue all inhalers. D. Restrict oxygen postoperatively. Answer, B. Preoperative teaching of deep breathing and coughing helps prevent postoperative atelectasis and respiratory complications in COPD patients. Which clinical manifestation suggests hypocalcemia in a postoperative thyroidectomy patient? A. Bradycardia. B. Muscle twitching and tingling around the mouth. C. Abdominal distension. D. Excessive urination. Answer, B. Hypocalcemia from parathyroid injury causes neuromuscular irritability, including facial twitching and perioral numbness. A patient receiving 4-vancomycin develops redness and flushing of the neck and face. What should the nurse do first? A. Stop the infusion immediately. B. Slow the infusion rate. C. Administer epinephrine. D. Flush the line with normal saline. Answer, B. Red man syndrome is caused by rapid vancomycin infusion. Slowing the rate usually resolves the reaction without stopping the medication. Which finding is most critical for a patient receiving 4-furosemide? A. Muscle cramps and weakness. B. Increased urine output. C. Decreased blood pressure. D. Weight loss. Answer, A. Muscle cramps suggest hypokalemia, a dangerous side effect of furosemide that can lead to arrhythmias if untreated. A nurse suspects compartment syndrome in a patient with a casted leg. Which sign confirms this diagnosis? A. Decreased swelling. B. Pain unrelieved by opioids. C. Decreased temperature. D. Rapid capillary refill. Answer, B. Pain out of proportion and unrelieved by opioids is the hallmark of compartment syndrome, requiring immediate cast removal or fasciotomy. Which patient is most at risk for metabolic acidosis? A. Patient with vomiting. B. Patient with diabetic ketoacidosis. C. Patient with prolonged hyperventilation. D. Patient on loop diuretics. Answer, B. In DKA, ketone accumulation leads to metabolic acidosis due to excess acid production and bicarbonate loss. Which electrolyte imbalance is expected with prolonged nasogastric suctioning? A. Hyperkalemia. B. Hypocalcemia. C. Hypokalemia. D. Hypermagnesemia. Answer, C. Gastric suctioning removes potassium and acid, leading to hypokalemia and metabolic alkalosis. Which symptom in a post-thyroidectomy patient suggests airway obstruction? A. Hoarseness. B. Difficulty swallowing saliva. C. Productive cough. D. Mild throat pain. Answer, B. Difficulty swallowing or stridor may indicate laryngeal edema or hematoma compressing the airway, an emergency situation. What should a nurse monitor most closely after administering 4-potassium chloride? A. Urine output. B. Heart rate. C. Blood pressure. D. Temperature. Answer, B. 4-potassium can cause dangerous arrhythmias. Continuous ECG monitoring is essential during administration. Which nursing intervention is appropriate for a patient with a newly created colostomy? A. Use hot water to clean the stoma. B. Apply barrier cream before attaching the pouch. C. Cover the stoma with gauze at all times. D. Avoid measuring output for the first 24 hours. Answer, B. Barrier creams protect the skin from irritation and leakage. The stoma should be cleaned gently with warm water only. Which assessment finding in a patient with Addison's disease requires immediate intervention? A. Fatigue and weight loss. B. Blood pressure 80/50 mmHg. C. Skin hyperpigmentation. D. Salt craving. Answer, B. Severe hypotension indicates adrenal crisis, a life-threatening emergency requiring immediate corticosteroid and fluid replacement. A nurse is caring for a patient with Guillain-Barré syndrome. What is the most critical assessment? A. Reflex response. B. Lung sounds and respiratory effort. C. Muscle tone. D. Pain level. Answer, B. Ascending paralysis can reach respiratory muscles. Monitoring breathing is vital to prevent respiratory failure. Which finding in a patient with chronic kidney disease indicates the need for dietary teaching? A. Choosing grilled chicken for dinner. B. Eating bananas and orange juice daily. C. Avoiding salt substitutes. D. Limiting dairy intake. Answer, B. Bananas and orange juice are high in potassium, which must be limited in renal patients to prevent hyperkalemia.